So today's topic is on the largest paid salivary gland, that is the parotid gland. So there are three paid major salivary glands, which are we know this is the largest one is the parotid gland, and which is located in the parotid region, which is inverted pyramidal in shape. And apart from parotid, we are having submandibular salivary gland and sublingual salivary glands. So these are the three paired major salivary glands. So let's begin the parotid gland. As I said, it is located in the parotid space or parotid region, and which is formed by the mold forming the bed for the parotid gland called as parotid bed. And in front of the auricle it is located. Parotid region is located in front of the auricle, and in behind the ramus of the mandible. So it is located retromandibular area. So anteriorly the parotid gland, here we can see it is related to the masseter muscle. This is the masseter muscle which is attached to the lateral surface of the ramus of the mandible. And posteriorly we can see the ear, and still more posteriorly here is the mastoid process, which is located just behind the ear. So posteriorly it is related to the mastoid process and the muscles attached to the mastoid process. And inferiorly we can see on the posterior the muscles attached here, we can see the sternocleidomastoid, which is covered by the platysma muscle. So here is the cross section of the parotid gland, and where we can understand the relations of the parotid gland in this image in a better way. So this is the lateral surface of the parotid gland, which is covered by the skin, superficial fascia, and part of a deep fascia which is called as parotido-masseteric fascia, which forms the false capsule of the parotid gland on the lateral side. And anteriorly we saw this is the ramus of the mandible, which provides attachment to masseter on the lateral aspect and medial pterygoid on the medial aspect. And posteriorly I said it is related to the mastoid process, and the two muscles which are attached to the mastoid process are the sternocleidomastoid and posterior belly of digastric. Laterally sternocleidomastoid and medially posterior belly of digastric. So these are the anterior and posterior relations of parotid. Medially, medial most we can see this is the wall of the pharynx, which is formed by the superior constrictor. So medial most it is related to the superior constrictor, and we can see a process here which is the styloid process, and providing attachment to three muscles and two ligaments, and the three muscles are styloglossus, stylohyoid, stylopharyngeus muscle, and the two ligaments are stylohyoid and stylomandibular ligament. So these are the structures attached to the styloid process which are related to the posteromedial aspect. And medial to the styloid process, if we see in the base of the skull, there are two foramens in front and behind the styloid process, that is the carotid canal and jugular foramen. So here is the internal carotid artery, and jugular foramen transmits internal jugular vein. Apart from these two vessels, also the 9th, 10th, 11th, 12th cranial nerves are also present on the medial side. So all these are related on the posteromedial aspect. So the parotid gland in transverse section, we can see this is the lateral surface or the superficial surface, which I said covered by the skin, superficial fascia, deep fascia, and superficial fascia contains the superficial parotid lymph nodes as well. And this is the anterior border, and here is the posterior border, and this projection is the medial border. This surface from anterior border, this from here to here, this is the anteromedial surface, and the posteromedial surface is from the medial border to here, this is the posteromedial surface. Posteromedial surface, we can see it is related to the styloid apparatus, means the styloid process, the structures attached to it and structures related to it is called styloid apparatus. And posteriorly it is also related to the mastoid process and structures attached to the mastoid process. So that is the wholesome relations of parotid gland in cross section. Next, histologically, parotid gland, if you see, it is a kind of serous type of salivary gland, means the secretions are watery secretions, and we can see a bright pink stain, that is the eosin stain, and we can see the round nuclei. The nuclei are round and they are located towards the basement membrane, and the cytoplasm is filled with the zymogen granules and brightly pink color stain it takes up. So it is a serous type, and as it is an exocrine gland, we can see ducts also which are located. So these are the ducts present within the gland. So coverings of the gland, it has got the true capsule and false capsule. The true capsule is intimately with the gland, and it develops from the gland itself. So the connective tissue of the gland present along with the gland is the true capsule. False capsule, it is derived from the deep cervical fascia from the neck. So when the deep cervical fascia reaches the lower tip of the gland, that is the apex of the gland, it splits into two lamina, superficial lamina and the deeper lamina. Superficial lamina is quite thick and dense, and it attaches above to the zygomatic arch. So superficial lamina is otherwise called as parotido-masseteric fascia. It is very thick. It is called as parotido-masseteric fascia. It does not allow the parotid gland to swell. So if there is any abscess in the parotid gland or any collection of the fluid in the parotid gland, it causes severe pain because of parotido-masseteric fascia, because parotido-masseteric fascia is an unyielding fascia. It is very tough and thick fascia. Next, about the deeper lamina. The deeper lamina is thin, lax and loose all over, and it gets thickened only between the styloid process and the mandible to form stylomandibular ligament. And this stylomandibular ligament separates the parotid gland from submandibular salivary gland. It separates the parotid gland from submandibular salivary gland. So these points to be noted. Parotido-masseteric fascia is nothing but the false capsule, which is a superficial lamina. It is quite thick and it is unyielding. If there is any collection of fluid in the parotid gland, it causes severe pain because of this fascia. Then about the deeper lamina, which is thin and loose, and it gets thickened between the styloid process and the mandible to form stylomandibular ligament, which separates the parotid from submandibular salivary gland. So these points to be noted. Next, about the structures passing through the parotid gland, we can remember as the nerve, artery, vein and artery. Okay, so the nerve is the most superficial structure. So the nerve is the facial nerve which divides within the gland like a foot of a goose, which is called as pes anserinus. So the division pattern of the facial nerve within the gland is like a foot of a goose. So it is called as pes anserinus, and the vein is the retromandibular vein, which is located in the gland itself, and the artery is the external carotid artery. External carotid artery is not present all through the length of the gland. Actually, it enters the gland somewhere in the midway from the medial aspect, and it divides into terminal divisions, terminal branches within the gland. So the terminal branches of the external carotid are the maxillary artery and superficial temporal artery. So we can see the maxillary and superficial temporal artery, which are divided within the, which are divided by the external carotid artery within the gland itself. And we can appreciate the retromandibular vein, which is formed within the gland by joining of superficial temporal vein and maxillary vein. So maxillary and superficial temporal joins to form retromandibular. Retromandibular, as it reaches the lower part of the gland, it divides again into two divisions, anterior division and posterior division. So these are the three structures which are present in the gland. One point to be noted here, as the nerve is the most superficial structure in the parotid gland, always the incision to drain the abscess in the parotid, it is done in the horizontal, which is called as Hilton's line of incision. So the horizontal incision is taken. We usually avoid vertical incision because the vertical incision may cause damage to the facial nerve. So that is the reason the horizontal incision is taken to prevent the damage to facial nerve, which is called as Hilton's line of incision. Next, here is the apex of the parotid, which is directed downwards, and base is directed towards the upwards. So here is the base of the parotid gland, and we can see the parotid duct, which is otherwise called as Stenson's duct, which starts from the anterior border of the parotid gland. So from the apex, we see the retromandibular vein divides into anterior division and posterior division. Anterior division is joining with the facial to form common facial vein. Posterior division joins with the posterior auricular vein to form external jugular vein. And we can see the facial nerve dividing into branches within the gland itself. So most superficial is the nerve, then vein, then artery. So from the apex, the structures which are emerging out is the anterior division of retromandibular vein and the lower branch of the facial nerve, which is called cervical branch of facial nerve, which meant to supply the platysma, which is a superficial muscle in the neck. And here is the anterior border. Structures emerging from the anterior border are, one is the parotid duct, we know that, and terminal branches of the facial, that is temporal branch and zygomatic branch, both together arise from zygomatic or temporal, and above the duct as the upper buccal and below the duct as the lower buccal branches, and we are having the marginal mandibular and cervical branch of facial nerve. So these are the branches which are given off within the gland, emerges out from the anterior border. Apart from the nerves, we can see the transverse facial artery. Transverse facial artery is a branch of superficial temporal artery. We know that external carotid artery divides in the gland into superficial temporal and maxillary artery. So superficial temporal gives off transverse facial artery, which also supplies the part of the face. And duct also emerges out from the gland, that is parotid duct or Stenson's duct, which is around 5 centimeters long, and it winds round the anterior border of the masseter and pierces buccal pad of fat, buccinator, buccopharyngeal fascia and pharyngobasilar fascia to open in the vestibule of the mouth. So here is the parotid duct which I am talking about, and it winds round the anterior border of the masseter, and sometimes it may be associated with the accessory parotid gland which is present above the duct. Normally it is present above the duct. After winding round the masseter, it pierces the buccinator muscle, buccal pad of fat, buccopharyngeal fascia and pharyngobasilar fascia. So four structures are pierced by the parotid duct to open up into the vestibule. Along with the parotid duct, the buccinator is also pierced by a nerve which is called as buccal nerve, which is not meant to supply the buccinator muscle. It is a branch of mandibular, that is the anterior division of mandibular. It supplies sensory supply to the buccal region. So sensory supply. So two structures pierces the buccinator muscle. One is the buccal nerve, which is a sensory nerve branch of mandibular, anterior division of mandibular. The other is the parotid duct or Stenson's duct. So it is the Stenson's duct is a thick walled duct which carries the secretions from the parotid gland to the vestibule of the mouth, and it is formed within the substance of the gland by union of two vertical ducts. So the length of the Stenson's duct is around 5 centimeters in length. You see here, this is Stenson's duct, masseter muscle. So we can see the termination of the parotid duct. So parotid duct, it ends by opening into the summit, forming a raised papilla, which is opposite to the crown of upper second molar tooth. It opens in the vestibule at the level of upper second molar tooth. Blood supply to the parotid gland, it is supplied by external carotid artery. So we know the gland contains the external carotid artery within it, which directly supplies the gland. Branches of external carotid artery. Venous drainage, we know the retromandibular vein is located within the gland. So finally it drains into external jugular vein posteriorly, The posterior division of retromandibular vein joins with the posterior auricular vein, we can see, and forms the external jugular vein. So most of the gland drains into external jugular vein. Anterior division of retromandibular vein, we can see it is joining with the facial to form common facial. Common facial drains into internal jugular vein. Lymphatic drainage, we have got superficial parotid lymph nodes and deep parotid lymph nodes. Superficial parotid lymph nodes are present within the superficial fascia covering the lateral surface of the gland, and deep parotid lymph nodes are located within the gland itself. So drains finally into superficial and deep, and from these lymph nodes, the principal lymph nodes of the head and neck region are jugulodigastric and jugulo-omohyoid. So finally they drain into upper deep cervical lymph nodes, which are called jugulodigastric lymph nodes. Now let us understand the parasympathetic pathway to parotid gland. So parasympathetic pathway is mainly by a ganglion called as otic ganglion. Otic means it is associated with the ear. So it is associated with external acoustic meatus near the parotid. So that is the reason it is called as otic ganglion. It is present in the infratemporal fossa. So this ganglion, it is functionally related to glossopharyngeal nerve, but topographically it is present along the mandibular nerve. So here we can see the parasympathetic pathway, that is the inferior salivatory nucleus, which is located in the medulla, gives rise to glossopharyngeal nerve. The fibers continue into the glossopharyngeal ninth cranial. Ninth cranial gives rise to a nerve called as tympanic branch of glossopharyngeal, which enters the middle ear through a small foramen, which is called as canaliculus for tympanic nerve from the floor of middle ear, and finally reaches the middle ear to form plexus, which is called tympanic plexus. And from the plexus we see a nerve arising, which is called as lesser petrosal nerve. Lesser petrosal nerve runs along with the mandibular nerve. It exits from the middle ear and runs along with the mandibular nerve to exit the cranial cavity through foramen ovale. And once it comes out through the foramen ovale, immediately it relays in a ganglion which is associated with the mandibular nerve, that is the otic ganglion. After relaying, the postganglionic fibers enters through the auriculotemporal nerve, which is a branch of mandibular nerve, and finally it supplies the parotid gland. So here this is the secretomotor pathway or parasympathetic pathway of parotid gland. Sympathetic supply to the parotid. Trigger of sympathetic causes the thick mucus secretions. We know parotid gland is a serous acini and thin watery secretions. So parasympathetic stimulation is more than the sympathetic stimulation. And vasomotor by sympathetic. So the postganglionic fibers for the sympathetic arise from superior cervical ganglion, which form plexus around the external carotid artery, which is located within the gland itself. And the sensory is by the auriculotemporal nerve. The sensory supply is by auriculotemporal, which is a branch of mandibular nerve, that is the posterior division of mandibular nerve, supplies the parotid gland. Let's see a few clinical aspects of parotid gland. So here is the superior view of the parotid. As we know, the facial nerve passes through the parotid gland. It divides the large superficial and small deeper parts, and in between the junction where the nerve is passing through, that forms the isthmus of the gland. So this plane, this fasciovenous plane is called as the Pate's fasciovenous plane or the isthmus where the facial nerve is located. So this plane is called as Pate's fasciovenous plane. The other applied aspects are the inflammatory swellings in the parotid gland. I said already, it is quite painful. It is because of a thick fascia which is present on the lateral side of the parotid, that is called as parotido-masseteric fascia, which attaches to the zygomatic arch, and it doesn't allow the parotid gland to swell. And parotid abscess may be due to the spread of infection from the oral cavity or due to the infection from the lymph nodes. It may result in the collection of pus or the fluid inside the gland called as parotid abscess. And viral infection of parotid, which is called as parotitis, or mumps, which is common in the children below 5 years of age, and we know the MMR vaccine, which is taken to prevent mumps. So MMR vaccine is not only for mumps, measles and rubella. So so if the infection, it causes a severe swelling, you can see, of the mumps, and resulting in a physiological lockjaw where the child won't be able to open the mouth because of severe pain. So viral parotitis causes very severe pain resulting in physiological lockjaw. Next, an interesting syndrome called as Fraze syndrome. The skin which is covering the parotid region, here the sensory supply of the skin is by greater auricular nerve and the secretomotor supply is by auriculotemporal nerve. Suppose if there is during excision or of the abscess or during any surgery in parotid gland, these nerves are cut. So what happens? There may be a chance of cross growth of the nerves. Means auriculotemporal fibers may enter the greater auricular, and greater auricular, which is a branch of cervical plexus with the root value C2 C3, may enter into the auriculotemporal fibers. So what happens when the person sees the food, instead of salivating they will start sweating in the parotid region, and parotid region becomes red in color. This condition is called as Fraze syndrome. Fraze syndrome, it occurs because of crisscrossing of the fibers from auriculotemporal nerve and greater auricular nerve. Greater auricular nerve, remember, it supplies the skin in front of the ear, parotid region, with the root value C2, C3. And this is the only part of face sensory supply is by greater auricular nerve. Remaining part of face is supplied by trigeminal nerve. That is the three divisions of trigeminal nerve. So here is the greater auricular. So it gets crossover with the auriculotemporal. We know auriculotemporal carries the parasympathetic or secretomotor fibers to the gland. So instead of salivating, the person will start sweating when they see the food. That is called as Fraze syndrome. So here are the few questions. A man presents to the clinic with new onset of left side facial drooping, loss of wrinkles on the ipsilateral side. There is also dysfunction of largest salivary gland on the same side. Which of the following cells make up the gland? So the option is missing. So the answer is, I hope you can know the answer. We know parotid is a kind of serous salivary gland. A 32-year-old man presents for the pain in its mouth, and the dental examination determines the pain is coming the area near the second maxillary molar, means upper molar. We know where the parotid duct opens. So what is the function of the duct? The main may be dysfunctional. So it secretes tears. No, it is a parotid. So it secretes salivary gland secretes amylase, which breaks down the carbohydrates in the mouth. So the answer is secretes amylase because the saliva contains enzyme called as ptyalin, and the ptyalin contains amylase enzyme which breaks down the carbohydrates to some extent in the mouth, which is the so answer is C is the answer. Which of the following structures does not cross the parotid? We know facial nerve crosses the parotid, external carotid passes, duct passes. So answer is internal carotid. Obviously it won't cross the parotid gland, but it is deep related to the parotid gland. So what provides the parasympathetic innervation of the parotid? So the options are facial, vestibular, vagus, glossopharyngeal. I hope you all know the answer now. We know the otic ganglion is functionally related to the glossopharyngeal. Topographically, it is related along with the mandibular nerve. So the answer is the glossopharyngeal nerve. So this completes the anatomy of parotid gland along with its structures passing through its nerve supply and some clinical aspects. Thank you.